Добрый день, уважаемые коллеги. Добро пожаловать
Dear
на
colleagues, good afternoon.
очередной
Welcome to
конференции
another,
вебинар PACE.
hopefully
Меня
interesting
зовут
webinar
Роман
organized
Сколоцкий, я
by
исполнительный
PASTE.
директор PACE.
My name is Roman
И
Sklotsky and
сегодня
I'm
я
the
накратко
executive director of
немножко
PASTE.
расскажу
And now we'll
о
share my slides
важных вещах.
because I'd like to present a couple
Сегодняшний
of
вебинар
important
проходит,
points. So today's webinar
посвящен, во-первых, обзору паллиативной помощи в
is an
Кыргызстане.
overview webinar
Сегодня у
on
нас очень
palliative care in Kyrgyzstan.
интересный
Today,
набор спикеров, набор экспертов
we've
из Кыргызстана,
invited
чему мы
a
очень рады.
very interesting
Это,
group
наверное,
of
буквально
speakers
очередной
and
список шагов.
experts.
А пока
We are very
посмотрим, что
happy about
вебинар
this. I'll
проходит
get
на
back to
двух
this list a
языках,
bit later,
на
because first
английском
I
и
would
на
like to
русском.
say
У нас
that our
сегодня много
webinar is
участников из
held in
разных
two
стран,
languages,
поэтому
English and Russian.
завести
Today we have a
конференцию
lot
для
of
вас
participants
удобнее.
joining from different countries.
Необходимо
So
выбрать
depending on
ту
the
или иную
language of your
дорожку
preference,
внизу,
please
на нижней
choose
панели
the
Zoom,
language
найти
track
иконку Zoom
in Zoom.
и выбрать
Please go to
английскую
the bottom
либо
of your
русскую
screen,
дорожку, в
click
зависимости от того, как
interpretation
вам
and
комфортнее.
choose either Russian or English, depending on
Для
what's more
тех,
comfortable for
кто
you.
пока не знаком или
For
плохо знаком
those
с
who are
PACE,
not
The Foundation for
well
Palliative Care
aware
Education,
of
я
PACE
хотел бы
yet,
сказать пару слов, что это
Foundation
международный
for
фонд,
Palliative Care
зарегистрирован в
Education,
2017
it's a
году в
charitable foundation
Великобритании
that was
для того,
registered
чтобы
in the
повышать
UK back in
доступность и
2017.
качество
Its
оказания паллиативной
main
помощи
goal is to
в странах
enhance the
Центральной Азии, Кавказа,
accessibility of a
Восточной Европы
palliative
и
care
Прибалтики
support education
через поддержку
in Central
специалистов и
Asia,
лидеров,
Caucasus, Eastern
которые
Europe,
в
and the
сфере
Baltic
работают.
countries through the support of the leaders
У
in
нас
this
есть
field.
наш веб-сайт,
We have our
и вы
website.
можете на нашем веб-сайте, во-первых, ознакомиться с нашими
There
предыдущими
you can see
публикациями,
first our
материалами в разделе
previous
Publication в качестве
publications and
публикаций.
materials. We have a special
Кроме того, для
section
того, чтобы
about
оставаться в
this.
курсе
It's called
новостей
publications.
и
On top of
значит
this,
событий, вы можете
to keep
подписаться
updated
на главной
about
странице
our
пролистать
news,
вниз и
you can
подписаться на
scroll down on the main
нашу
page
рассылку.
and sign up to
Сейчас вы
our
еще раз
newsletters.
в чате увидите
Now we'll copy the link
ссылку на наш сайт.
to our website, to our Zoom chat. So if you're interested, please sign up for our newsletters. In addition, we have the chat for palliative care specialists in PACE presence countries such as Central Asia, Caucasus, Eastern Europe, and the Baltic countries. So if you're interested in joining this chat, you should now see the link in our Zoom chat to our other chat, and we'll be very happy to add you to our closed chat for experts and professionals. Well, of course, we are present on social media and we are quite active there. So depending where it's best to follow us, for you, you can join us on Facebook, LinkedIn, on Instagram. Please like our posts and share this information with other colleagues because we do hope that we do interesting and useful work in this regard. And we now can step by step start our webinar. Once again, my name is Roman Sklotsky and I'm the Executive Director of PACE Foundation. Today, we have simultaneous interpreters working for you. Our names are Anna Akmaeva and Ksenia Ruzova. Very happy that today we offer simultaneous interpretation. And so for those who have just joined us, I would like to once again remind you that our webinar is held in two working languages, English and Russian. So to choose the language of your preference, please go to the bottom of your Zoom screen, choose the globe button and choose the track, Russian or English. And I would like to welcome our colleagues from Kyrgyzstan in Kyrgyz language. I hope it was the right pronunciation. Hello, dear colleagues. We're very happy to see you with us today. So today's webinar is an overview webinar of palliative care in Kyrgyzstan. In my opinion, it's very important to discuss this because Kyrgyzstan is a great country with very nice people, with the population of about 7 million people, with a beautiful nature, beautiful cuisine. At the same time, this is a country like any other country where people also die. And today we'd like to discuss how palliative palliative care is developing in Kyrgyzstan, what are the achievements, barriers, and challenges. And I've already seen the presentations from our colleagues from Kyrgyzstan, and I think that today we are presented with the very good opportunity to see what's happening in palliative care in Kyrgyzstan regarding education, non-commercial organizations, associations, public bodies, etc. I think it's especially important because Kyrgyzstan should also and is presented at the palliative care world map. We continue our journey on this map. We stopped in different countries and we did some shorter overviews, but we also gave some specific examples. So we also made some stops in Armenia, in Georgia, in Kazakhstan, in Belarus, in Latvia. And one of the latest stops of ours was in the Czech Republic. And now we are coming to Kyrgyzstan with our journey across a palliative care map. And it's my great pleasure to introduce our speakers today. We actually have a lot of speakers, and they're all unique when it comes to their expertise. And we are really looking forward to your presentations about what is happening in palliative care in Kyrgyzstan. As far as we understand, it's been developing for the last 15 years quite actively, and obviously there are some other goals to achieve. And before introducing our speakers, I would still like to mention that the webinars like this one are quite important because on the one hand, we are united by a common goal. We really want to make palliative care human-centered. We would like to enable people to live their lives till the very end. But our way towards achieving this goal is different for all of us. It's a bumpy ride for everybody who is involved. And I think it's very important to take a look at the journeys of each other, to exchange experience, to get inspired, to get some useful information, to take a look at some useful practical cases. And I think it's a very useful initiative. And now I'd like to introduce our distinguished speakers in the order that they will present. First, Taalaigul Sabyrbekova, co-chair of the Association of Palliative Hospice Care in Kyrgyzstan. Hello, distinguished Taalaigul. Next, Milana Turgunalieva. Hello, Milana. We can see you. Thank you for joining us. She's a co-chair of the Association of Palliative and Hospice Care in Kyrgyzstan. Gulzhakhan Pirnazarova, head of the Department of Nursery in Family Medicine at Kyrgyz State Medical Institute of Retraining and Training of Medical Staff named after Daniyarov. Next, we also have a palliative care doctor from the First Children's Hospice, Maral Turdumatova. Hello, Maral. Very nice to see you. We also have Edilbek Turgunbaev, director of the Republican Rehabilitation Center. Hello, Edilbek. And today we also have Azamat Kubataev. Just like Milana, he is a representative of an NGO. He is a director of the charitable foundation Fountain of Life, or Fontan Жизни in Russian. Hello, Azamat. Thank you for joining us. I know that your internet connection today is not very stable, but thank you for joining us in any case. So, colleagues, first I'd like to give the floor to our first speaker, Taalaigul. So she will talk about the overview and the demands in palliative care in Kyrgyzstan, how palliative care is organized in Kyrgyzstan today, what is the legal framework behind it, and also she will talk about the key challenges, key tasks to achieve in the nearest future. And then we'll just go back to and go deeper into different topics. And now I'd like to give the floor to Taalaigul to give this overview. So Taalaigul, could you please share your screen? Yes, hello. Hello, dear colleagues. Roman, thank you. And Ira, thank you very much for organizing this platform and providing this opportunity for us. It's a great pleasure and a big opportunity for us to be today with you and to keep in touch with other colleagues from other countries who would really like to be participating in this network. And it's indeed very nice for us to be here. So I will really try to stay within the time frame that I'm given. It's actually quite a privilege for me to start. I will focus, as you said, on the system as it is. And on the next slide, I will talk about the following. In the context of palliative care, I would like just to give you a short overview of our country. So our population is a bit more than 7 million people. We are located among mountains. We have a lot of mountains, and well, our life expectancy on average is about 71 year, and most of our people live in rural areas, and of course, it influences medical care availability and accessibility. Next slide, please. So the demand for palliative care in Kyrgyzstan was initially identified back in 2012. And then we've been using the same method and we calculated this demand for 2024 already. So as you see, the general overall demand in palliative care per year is about 19,000 people, and more than half of these people are suffering from cardiovascular diseases. Cancer is at the second place here, as well as other diseases. Another big study conducted by interdisciplinary working group. This study was done in 2016, and it was also devoted to children. About 9,000 children need specialized palliative care, and about 19,000 children also had to get palliative care. And the most common problem is the destruction of the blood circulation, endocrine, and other systems. And there are some other diseases. Could you please keep switching to the next slides, because I have some empty pictures, unfortunately, here. Well, I'm afraid you can't see it either, but still, the system of palliative care consists of 4 levels. Let's move to the next slide. So the first level is the primary health care. Let's start with this one. For us, it's a foundational level. When one lives in a rural area, in a village, this person shall also have access to medical services. And on the next slide, we will see what primary healthcare consists of. Could you please go to the next slide? Thank you. So, we have a very well distributed primary healthcare system. It consists of some large centers of family medicine. Those are located in different areas, in cities, in towns. So those are medical professionals that are quite specialized, such as oncologists, otolaryngologists, and others. So it's quite a narrow, specified, I mean, but still a clinic service. And we have 17 centers of family doctors, and we also have more than 1,000 of obstetrics clinics. So as we said, we have about 7 million people living in Kyrgyzstan, and all people are assigned to some specific center at the primary level. So these people can get access to this professional and specialized medical help. So what are the services that can be given? First, the status identification if somebody needs palliative care. Next, mobile support. Also, Next one, pain relief, especially if there are any severe symptoms, and also issuance of prescriptions for medicines across different state programs. We have a state guarantees program, and we also have an additional package of obligatory medical insurance. This also works. But here we still have some gaps to close, such as provision of transportation, as well as provision of medicines and additional financing for the workers in this system. Next slide, please. Next level here are the hospitals. And let's take a look at how hospitals look like. Thank you. So in Kyrgyzstan, we have region-related hospitals, unified territory hospitals, other ones, and also the general practice hospitals. We have more than 60 like this. So in this case, these hospitals can provide help to those patients that cannot get this help at home. They also offer psychological support and train in care, but still this does not completely work now in Kyrgyzstan, because now our patients are either at home or at the next level of getting this care. So later I'll talk about how we should keep developing this level of hospitals for us to make it even more efficient. So next level, it's quite a new one for us, and I will not stop here for a long time because the head of this hospital will talk about it, Edilbek. It's the level that is called the Hospital of Palliative Care. What do we mean here? We've got our first Republican level hospital of palliative care. It's not just a department, but it's a whole hospital. So they're not specialized on anything in specific. They offer help and services to all palliative patients. And our goal, and we are supported here by the Ministry of Healthcare, we want to make this hospital the methodological and educational center, the one that will train doctors, GPs across the whole country. Also, we would like to organize the online group discussions, medical ones, consiliums, so to say. So we would really like to keep developing this third level. And as I said, it's one of our goals. We believe that we can reach this goal through training our staff, through introduction of the major of palliative doctor, and also through sufficient financial support. Next slide, please. So here you see that we also have a specialized palliative care at the third level. Here we talk about national hospitals. So, for example, we have the National Center of Oncology and Hematology. It's a tertiary level. So this oncology center has 25 beds. Also, we have OSHA Center of Oncology. It has 10 beds. They offer chemotherapy, radiotherapy, surgery for palliative patients. It's also available. As we've seen still before, about 52% of palliative care patients are suffering from cardiovascular diseases. And we don't have special departments yet that could support patients with this group of diseases. And we think that these tertiary palliative care hospitals could perform this role. Now we at least think that we need to keep introducing palliative care and also connect it to the primary health care. Next slide, please. Next. And so everything that I've said was related to the system, what it looks like. It took us quite a long time to reach this level. And in 2012, the Ministry of Healthcare adopted a strategy on the development of palliative care. And in 2016, there was a law adopted where the definition of palliative care was enshrined in the law on the health protection of the population. That was a big step. There was a recognition from the state. The state recognized that this service is indeed needed, and it was added to the law.
Пошли другие, значит, изменения, как бы поддержка, нормативные документы в исполнении.
And that the regulating documents were adopted in order to follow their stipulations of the law. And next slide demonstrates to you that in 2014, the first clinical guidelines were developed, as well as the clinical protocol for providing palliative care. And it was introduced, and it is being introduced, and that is something what my colleague will talk about later. We will talk about ways to organize trainings. Moving on. And here, as you can see, over the past years, we have seen changes as well. There is a law on healthcare, and it has been revised majorly. And there is one article dedicated to palliative care, and it says that it should be provided at various levels, and there should be a procedure developed, and according to this procedure, the availability of such services will become more available. We can say that the first protocol was developed 10 years ago, and of course we realized at a certain point of time that it had to be updated, it had to be renewed, and a large working group was established. One of the group members was Dr. Maral. So we have revised the guidelines, and last year the modifications and updates were approved by the Ministry of Health. And I'm not here you see also some guidelines regarding the dispensing of the medications, but my colleague will talk about it in greater detail. Well, we, as an association, have 4 key tasks, that is integrating palliative care, so it should be available at the primary level, providing access to the medications, providing services of palliative care in general care hospitals. And so far we have 1 hospital like this in Bishkek, but we will open the second one soon. Thank you very much for your attention. Thank you very much, Taalaigul, for such a succinct message. And of course, we understand that a great deal of work has been done. And of course, I would like to learn more about various aspects. I understand that in Kyrgyzstan, in terms of the level of care, there can be difference between rural areas and the capital. It's very interesting to discuss what you did to introduce changes in the healthcare law. But actually, as for the Q&A session, I suggest that it takes place at the very end. But let me also read comments from our colleague from Armenia. She said it's really great that in Kyrgyzstan there is no specification of palliative care based on the pathology, because very often the patients with chronic diseases and they're not covered by palliative care. Well, thank you very much, Narine, and we are glad to see you. And as Igor said, we will give the floor to Milana Turgunalieva. She is the co-chair of the Association on Palliative Care and Hospice Care, and she will talk about the cornerstones of the palliative care. Of course, we will talk about pain relief, pain management, and we understand there are countries where things do not look ideal in terms of providing the pain relievers. So let's see how this issue is regulated, what challenges are the ones that the association counterface. And Milana, the floor is yours. Hello, dear colleagues. I'm really glad to be here. Thank you, Roman. Thank you, all the organizers. Thank you, Irina. And actually, I have attended a number of your webinars, and the organization is always excellent. So let me introduce my speech. As it already has been said, palliative care. And when it comes to pain management, this is the central issue. And of course, without medical provision, namely pain management, it is something we cannot go without. Well, dear colleagues, in order to bring revolutionary changes, remove all the barriers for providing pain management drugs, and prove that things can look good on paper. However, reality will be totally different, and there are not available drugs. We have created a study, a survey, and we have realized that even the Department of Medication Provision may have certain picture. We have analyzed 300 pharmacies, and we realized that only 39 pharmacies provide pain management medication on a continuous basis, and that is a very small percentage. As my colleague said, we have a mountain country, we have lots of rural, faraway remote areas, and sometimes some pharmacies are located 100 to 180 kilometers far away from certain settlements, and the relatives would have to travel such huge distances to get pain management medications. They're so essential for the palliative patients, and we received these great results in terms of the medications or drugs availability. And if we give a short review on the social guarantee program and availability and range of the drugs, this is what we have. So we have morphine, that is a state standard. And I think here we are pretty safe. However, there are certain aspects to keep in mind. For instance, if the injection solutions were always available and they're available in pharmacies, the short-term medications or short-term effect medications are not widely available because they were registered only in 2013, and also the prolonged effect tablets or something what you cannot find easily in the pharmacies, because when it comes to prolonged effect, it's very difficult to get a prescription due to titration issues. And as for the internal intake solution, and that is something what we use for palliative pediatric patients. Again, here we have a problem because this medication was registered not long ago and it is not available. And as for tramadol, it is available in various dosage forms, but is something you cannot find everywhere. We also have trimidine, and it is not should not be used for treating chronic pain syndrome, and it is not included in our clinical guidelines, but still it is prescribed and you can find it in the pharmacies. And as for fentanyl, it was used, however, it was not registered. It is in the list of the essential drugs, but again, not available at this point of time. In terms of the financial availability, thanks to the state policy and state guarantees, it is provided to patients in a certain number of milligrams. And there are two problems here. One problem is that there are some beneficial programs, but they set forth limitations. And this medication is provided only to cancer patients at terminal stages, and 5,000 milligrams per year as an oral dosage for one patient. It is something what certainly is not enough for a 1-year term. We addressed a number of questions as part of our survey, and the pharmacists said that when they do the expertise of the prescriptions, there were lots of mistakes. Sometimes the prescriptions are outdated. In other cases, the prescriptions lack the seals, or sometimes there are not copies of ID, like passport. For some reason, you need to do it. And these were the reasons why the patients wouldn't receive the medications in duly manner, while the medical professionals would say that they needed training for given prescriptions. And of course, the validity of the prescription is very short. It is only as short as 5 days. We also don't have the calculation for titrations. And also, you need to make up a commission of 5 people to issue a prescription. You also need to collect the empty ampules and return them. And only after you return them, you can get another prescription. And the total paperwork is very cumbersome. That is something what was highlighted by the highlighted by the doctor. So what changes did we see in 2023, 2024? We saw the adoption of the new law in March 2024 about narcotic drugs, psychotropic substances, their analogs and precursors. And there was a very good article that could serve as a good start, because it stipulates the need to provide the aforementioned drugs and substances in medical and treatment purposes, scientific purposes, and so on. And changes were introduced in decrees that procedures that regulate the dispensing of drugs, the conditions for storage conditions, and so on. And now we see that the validity of the prescription is as long as 14 days versus 5 days, what we used to have. We also canceled the need to have a seal, heraldic seal, and patient can get an opioid analgesic based on the prescription in any pharmacy, not in the area of their registration. Thank God for that. And finally, in case of need to get narcotic drugs after the patient discharged from the hospital, the health care organization must provide the patients with narcotic drugs and psychotropic substances for their 5-day need. And yes, of course, that if you think that the patient returns back home and he needs to go through a number of procedures and paperwork, he still needs to receive pain management while doing all that. Now we are carrying out work as part of our new project, and we would like to cancel requirement for returning new ampules, because this is a limitation, it's a barrier. We also would like to provide hospital doctors an opportunity to give prescriptions. We would like to prolong the prescription validation day, because the country is large and sometimes you have to travel far away. And also, we hope to lax requirements for the legal turnover or controlled substances and drugs for the doctors of the remote health centers. And those doctors that visit the patients at home. Well, here I will talk very shortly about our state guarantee program. So ketoprofen is issued in the volume of 49,000 milligrams for the oncological patients at terminal stage. Morphine is given in the amount of 5,000 milligrams, and tramadol is prescribed in the volume of 4,400 milligrams. So, as for the accessibility of the pain management drugs, what are the problems that we face? First of all, the doctors sometimes have fear for prescribing morphine, or they have lack of knowledge. They are not good at doing titration. Then you see that the lack of stable demand results in the fact that some of the pharmacies do not have a stable supply, and also some of the dosage forms are not available. Fourthly, we have a deficit at the pharmaceutical market, including the decommissioning or inavailability of essential drugs for various reasons, like import dependency, geopolitical situation, and so on. And we are the country that majorly depends on the imported products. And of course, we have various legal barriers as well. What are the ways to solve the problems, and what are our plans? First of all, we need to provide training for the doctors and pharmacists in terms of dosages, titration, use of protocols to manage chronic pain, to write out the prescriptions, and also we need to provide trainings for the legal requirements. Secondly, we need to do the centralized procurements of the pain management medications, especially for remote pharmacies. We also need to increase the drug range, especially for children, and we need to make sure that they are available everywhere. We need to improve our logistic system so that we provide continuous supply of medications, especially for far away remote areas. So logistics really matters, and we need to focus on it. And of course, we need to improve our legal framework and remove barriers that so far exacerbate their accessibility to such needed products. And with this, I would like to thank you for your attention. And here you see the real life photos. We have our friend from Switzerland who sent me those photos. We went to a mountain area called Narin, where we gave a lecture, where we provided training for doctors. We walked around the pharmacies, we had talks, we took a look at our prescriptions, and these are the photos that we made as part of our field trips. So we are trying to improve the accessibility. We talk to doctors, and we do our best to improve the situation. Thank you very much for your attention. Thank you for Milana. And the great value of your presentation is your practical approach. So you're very well rooted, very well grounded. You know what is going on with the patients in terms of the products availability, drug availability, because yes, reports official reports can give you one picture, but it can be far away from the reality. And it's very important to understand what is really going on, what is going on with the patients, and then and only then you can improve the situation for the better. And we have two questions from Nerine, and I hope, Milana, you will be able to answer them. First question, what protocols do you use for prescribing prolonged morphine? Thank you very much for your question. I will shortly tell you, and you can. We have a protocol that has been approved by the ministry, protocol for training the chronic pain management.
Либо в индивидуальных чатах продолжить общение и уточнить какие-то вопросы. И второй вопрос тоже от Нарины Мансисян.
And the second question, also from Narine, it's connected to Promidol. Do you widely use Promidol? Yes, we do use it widely, even though we train and we talk about it, but still it's widely used. It's still in the pharmacies available. It's still quite popular, let's call it like this, but we will keep working on it because now we still use it quite widely. Okay, thank you very much, Milana. So I would like to remind our participants that you can pose your questions in the chat. Our speakers can answer these questions either in Russian or in English, and we'll also try to give some time in the end to discuss these questions. And now I'd like to build this bridge towards education, because Milana also mentioned training a couple of times, and I think that it's a very good bridge to Gulzhakhan Pirnazarova. She's the head of the Department of Nursery in Family Medicine at Kyrgyz State Medical Institute of Retraining and Advanced Training after Daniyarov. And so the presentation will be about the training in palliative care, how it all started, and what's happening now. Gulzhakhan, over to you, and we will share your slides. Hello, dear colleagues. Hello, dear organizers. Thank you for giving this opportunity. To talk about how palliative training and education is developing in Kyrgyzstan. Next slide, please. I hope you can hear me. You can hear me and see me, right? Please confirm. Yes, it's fine. No worries. Right, so today we've gathered professionals in the field of palliative care, and I guess we all understand that palliative care is necessary and is an integral part of healthcare in our countries. And it's important for us to train and to retrain professionals in palliative care in our country. So palliative care indeed plays a huge role here. Next slide, please. So palliative care can be given only by a professional who got trained in palliative care and has a certificate confirming this. After the completion of training, the participants in the training get knowledge and skills, and those are confirmed by certificates for medical degree professionals and just statements that they got trained for those who don't have a medical degree. So the development of palliative care training, it has goals and tasks. So one of the goals is to assess the demand coming from the population in the field of palliative care, and also to study recommendations on how to give a palliative care. And the tasks are to train professionals in the field of palliative care education. Those professionals would approve and draft the programs. And of course, here we really needed to get some help from international experts. Next slide, please. So when I was talking about the preparation stage, it was from 2007 through 2012. Our experts were coming and participating to international conferences in Australia, in Slovakia. Next slide, please. Also, there was a great course in palliative care in Bratislava, and There we also organized an internship based on Esperance Hospice in Romania. It was in Brasov. And we also went to Korea, as well as in 2022 and 2024 we went to Salzburg, to Austria. And last year we also had an international internship in Torun in Poland on long-term care. So here I put some pictures to depict how important it was for us to participate in international internships, how we learned about the experience from our colleagues from Romania, from Poland, and Princess Diana actually gave to the hospice in Romania the vehicle, the transportation vehicle, to enable them to offer mobile aid and care. So Romania got quite lucky in this respect, and I'm very thankful to the colleagues from Romania for the great work that they've been doing. So as I said, it was very important for us to get international experience. So we went to Poland, to Austria to do internships. We were based in hospices, in some social homes, and it was not only theory but also practice for us. We trained our teachers who were preparing to become teachers in palliative care in Kyrgyzstan later. Next slide, please. And as my colleagues already mentioned, starting from autumn 2012, we started to retrain doctors, paramedics, and nurses in palliative care. So this was done based on modules IPAC and ILNEC in Kyrgyz State Medical University. So we rented this to different professionals. We organized conferences, workshops. We also invited international experts in palliative care and pain relief. Next slide, please. The Ministry of Healthcare adopted the plan and timeline on continuous education of medical professionals in 2012-2013, and there was a section on palliative care. It underlined the role of those who work at the primary level of healthcare, such as doctors, paramedics, nurses, social workers. Originally, the program had 80 hours, 2 weeks and 32 hours of theory and 48 hours of practice. And the training program for doctors was about 40 hours. The previous one was for nurses, paramedics, and social workers. We also conducted a lot of visits to social institutions and other homes, and also we added the section on home visits, and that's how we enable the work of a multidisciplinary team. Next slide, please. So, as I already said, the role of international consultants was very significant. Why? Because they also helped us to draft some training guidelines. You know that in post-Soviet countries, we have the problem of the lack of training materials. And we had the consultants, Anna Kryshkova and Yulia Shlarmanova from Slovak Aid. And together we managed to draft some guideline, which is called Personnel and Improvements of Services in 2011. And in 2015, together with the consultants from Geneva, Louis Luton, Caroline Mattis, and Isla Grivel, we also drafted a brochure which was titled 9 Main Symptoms and Care of Palliative Patients. And those are guiding documents for us. We also give these documents to others because we are really guided by these works when we train palliative care professionals. Next slide, please. So that's how it looks like. On the left, you can see the work that was drafted together with Slovak Aid, and to the right, work together with our consultants, partners from Switzerland. Next slide, please. So training program on the basics of palliative care were for 80, 72, and 36 training hours. We review these programs every 3 to 5 years. We also have working groups that draft protocols and guidelines in palliative care, as well as on pain relief. Starting from 2020, professionals in nursing and doctors get trained during the program of 36 hours. This year, we adopted a new curriculum with new approaches. It is called multidisciplinary approach in palliative care. This is for teachers of colleges, of universities, social workers, and others, also spiritual representatives. Because when we talk about a multidisciplinary team, this one should also include spiritual experts. So how do we organize this training? What are the formats? Well, we give lectures, workshops, practice-oriented classes. We hold discussions, case review, brainstorm, and group work. Next slide, please. So here you can see the workshop, how it's done. Usually we do it at the bed of a patient. Our medical professionals perform manipulations. They drill their skills, the ones that they learned during the theory classes. And well, we really try to motivate our students. We also give the brochures that I mentioned as a gift to them. Next slide, please. There was a very interesting situation in Bishkek, in Kyrgyzstan. The spiritual administration reached us. They wanted us to train Sisters of Mercy. So they have volunteers who help homeless people as well as people that are incapacitated, people with disabilities. As we know, even homeless people can have disabilities. And so here you can see the picture. We given a 2-week course to these nurses on pain relief, on bed sores prevention and prophylaxis, etc. So it's a very important picture for me because these women came to us and they wanted to get trained. So the spiritual administration of Kyrgyzstan asked us to give this training. Next slide, please. So professional on palliative care should have two basic competences: to know and to be able to perform something. What shall they know? First, they should be good at interpersonal communication. Also, they should know how to take care of different patients. Also, they need to assess different pain situations. They should also assess the ethical principles, take into account the cultures of different families. They should also work while adapting a family if this family has survived some loss. Next slide, please. What else should professionals in palliative care be able to do? So they can and should be able to perform manipulations. Also, they need to be able to assess the severity and character of a pain. They should also control the pathological conditions of the systems that's important for the patient to live. They should also assess the psychological aspects. They should be good at communication, especially while contacting with patients and their families. And they also should be able to train families how to take care of their patients. So we added 9 sections to our curriculum, to the training program. And we proceeded from international modules, ILNIC and others. So the first section is about palliative care in general. Also, we add some legislative aspects and legal ones. It's first. Second section is about pain relief. Also, we talk about symptoms, psychological aspects, how to go through laws, etc. So this all is included in our training program. I guess everybody understands that the main goal of a medical professional is to first work with the symptoms, to offer pain relief to a patient. That's why during our workshops we talk about it quite often, and we really try to tell about this right culture. What is pain? What are the scales that are used to assess pain? How shall one help patients who cannot really explain the severity of their pain? How to assess this all? And that's what we use the scales for. Next, please. Also, at the bed of a patient, our medical professionals and experts also have some practical workshops. So we go to oncology centers, we go to palliative care departments, we also perform home visits, we talk to our patients there, we give our aid, assistance, and we also provide consultations. Next one, please. Well, there are 9 symptoms that a caregiver should be aware of. I've listed them here. So it's pain, fatigue, nausea, depression, etc. And also, we would like to assess the severity of these symptoms, how to differentiate, for example, depression and anxiety, what can be the conditions, what steps should we take to give help if there are problems with gastrointestinal tract, such as constipation, diarrhea, appetite loss, what to do if there is dyspnea, if there are some problems with the respiratory system. And also here we talk about what's a good condition. Usually when we ask our patients, they say, we ask about how they are doing, how they are actually. The patients just say, yeah, everything is fine. But our caregivers are trained to really try to assess it properly because they ask additional questions. For example, a patient said, it's okay, and the caregiver asks, okay, it's okay, but what exactly do you feel? And they use scales to understand the severity of pain, to come up with the right approach, how to treat this particular patient and how to communicate with the patient's family. Next slide, please. So, as I said, we've drafted a brochure and we spread it around in Kyrgyzstan and abroad. So we give it as a gift to our best students. Here we prioritize both theory and practice. Here, for example, you can see pictures from the rehabilitation center. I guess that we have a speaker joining from this rehabilitation center as well. So here we see both doctors and nurses and some sanitary staff. And also we participated in a conference in Poland, and we also wanted and managed to hand out our brochures, also to establish contacts, to later on exchange our experience. I would also like to mention that we are open to international cooperation in the formats of international trainings. We are ready to visit somebody, and we are ready also to welcome others in Kyrgyzstan. So during training, teachers and professors did huge work to analyze curriculum, pre-graduate, postgraduate. Our teachers also work with the College of Vocational Education programs. Teachers from those institutions come to us on a regular basis as well, and we trained about 2,500 of doctors, paramedics, and nurses, and social workers based on LNEC and IPEC. In 2016, we did a randomized survey to understand what is the satisfaction of our population with palliative care. The satisfaction was about 54%. I mean, 54% of people who were surveyed said that they were satisfied. It shows the importance and significance and understanding of palliative care, but I think that this year, if we do the same, then this level would even be higher. Next, the main challenge. While we're training qualified personnel in palliative care, we don't have enough training centers where people could go to get trained. Still, we have lack of professional teachers and experts in palliative care to train others. That's why we are open to many opportunities here. And another challenge is that there is not enough intersectoral cooperation between healthcare services, social services in the field of palliative care. Quite often, our medical staff performs functions of social workers, and I would really like to see this cooperation more established to be able to render palliative care services to our population at a good level. Next slide, please. The results. We adopted training programs. They've been operating for 14 years already. These programs get updated and improved. We get new information.
Процентов у нас на практику, 40% на теоретический уровень знаний. И составлены договоры со стационарами, клиниками и социальными учреждениями по предоставлению клинических баз для закрепления
hospitals and clinics to provide trainings and improve the skills continuously. So this work is underway. We also, when developing educational standards about palliative care, we need to include into their curriculums legal questions, ethical questions, and also some clarities for tactics of palliative care, and interactive remote training of for medical professionals will allow to expedite the process of training, especially that is relevant for the regions of our republic. And I believe that online courses and remote training will play their positive role, and the future lies here. With this, I finish, and I have also I would like to thank you for this comprehensive review about what's going on in this field of training and education. While you were talking, we received lots of supportive and welcoming remarks, and your colleagues admire what you do, especially given the background of often limited resources, and everyone is really can see how much you can achieve, and they congratulate you on your achievements, and I kind of ask you to move along these lines. Thank you. And what you have said about education, yes, emphasizes the importance of experience exchange and importance of being in touch with your foreign counterparts. Because if we work on our own, we are not connected, the progress will not accelerate. Well, thank you, Gulzhakhan, and we are moving on, and now we are going to give the floor to our next speaker. Well, actually, if you have any questions, you can write them in the chat, and maybe our colleagues in Kyrgyzstan can answer the questions, seeing them in the chat. Because we do not have too much time left. And now I give the floor to Maral Turdumatova. First, I'd introduce her as the doctor of the palliative care of the first kids hospice, but she does so much more. She also teaches at the High School of Medicine, and right now she is writing her PhD thesis, and she is the winner of the PACE program, and we would like to congratulate you once again. So we are very glad to see you, and she's going to share her experience in terms of what the hospice does and what programs they have, and what are the challenges. Maral, the floor is yours. Thank you. Thank you for providing this opportunity. Well, I would like to talk about our hospice program.
Это более 2016 года данные. 19 тысяч, ну, почти что 20 тысяч детей нуждаются в паллиативной помощи, из которых почти что 8 тысяч это идет те, кто
So
нуждается в
about
специализированной помощи.
8,000 of children need palliative care. Specific one in general, it's about 19,000. And we have also people and children with cerebral palsy registered, and it's among one of the most common diseases in palliative care. So our children's hospice in Bishkek was founded in 2015. It's the first children's hospice in Kyrgyzstan, and it renders aid from 0 to 20 years old to children. The mission of the hospice is to help people with incurable diseases, also to render psychological, social, medical support, and to increase the quality of life at all the stages. Also, in 2015, we were renting, and then in 2016, we moved to another building. And also, it's thanks to the support of the president and the mayor, and also thanks to the state. We will give a diploma.
Мы тесно сотрудничаем с реанимациями в наших государственных больницах. Плюс к этому с этого года будут давать
Additionally,
расходники
as of
детям,
this year, we are going to provide disposable materials for those kids that receive artificial lung ventilation, and we are going to provide other disposable materials as well as of this year. And it turns out that most our kids that stay in the intensive care unit can be discharged at a certain point of time, and this is really good. So that means that they are not they don't stay in hospital for a very long time, and it's better for them to be taken care of at home, and we provide them maximum care as much as we can. Well, as for the capacity, we have only 7 wards for 7 families. The total square is around 500 square meters. So we try to provide home-like atmosphere, so the children will not feel like in hospital. So who do we take care of? We have 80 kids that we take care of. We have babies and teenagers. The core diagnosis are neuromuscle diseases, muscle dystrophy, Duchenne disease, the pressure sore diseases, cancer diseases, organic disorders of the central nervous systems, and so on, genetical diseases as well. And we have lots of patients at the terminal stages. We also have some patients with stomas, in coma, the ones that need the respiratory care. And palliative care is provided at various stages of terminal incurable diseases, and providing such care makes children maintain good level of life for a long time. These are our kids, the photos. We can move on to the next slide, please. Next slide, please. In Kyrgyzstan, there are over 5,200 children with the cerebral palsy. Of course, pain is the most common symptom with cerebral palsy, and 70 to 75% of patients report about pain. As for the cancer disease, it's not the most common condition for our children, and only 10 or 20% of all the patients have cancer. We provide care at the terminal stage of a disease, and that means that the family has a choice. At the terminal stage, the children can stay at home or they can be discharged, but once they do it, they can receive the equipment for using it at home, like AMBU, back pulse meter, special mattress against the pressure sores, and so on. But if they choose to stay at hospice, they can do so. And again, either way, the patient will have continuous support of our colleagues, and we provide maximum help, and we do it continuously in round-the-clock manner. As for the key programs, there is at-home care, that is for those families who prefer to go home. Also, social break, that is when the child can stay in the hospital, then we have the support center. We have also the care at the terminal stage, psychological support, nutritional care, and so on. As for the psychological support, it is provided not only for parents, but also for the employees. We have psychologists, and here you can see how the psychological support provides, what are the formats that we use. As for the parent club, when a family receives a child in need, it is always very hard. Therefore, very often parents feel isolated, and their attention fully focuses on the child. And of course, we understand if parents are not happy, if they feel devastated, if they don't have a resource, they cannot do anything for their child. And we believe that our parents of children with need are fantastic people with kind heart. And if you provide them proper care and let them know that they are not alone, these incredible people can do anything, and they provide even better care for their kids. As for the social break, this is a special program within the framework of which, and I believe the name is quite telling. So, if that program enables parents to leave their child in hospice, so where the child receives proper care, while parents can take a break or can do something what they need. It's very important, so parents won't have a emotional or burn down. And these are all the true pictures from our daily life. We understand that all our children need nutritional support for a simple reason, because due to various indications or contraindications, they cannot consume regular food. And sometimes it is simply prohibited. Therefore, many of our children receive special nutrition. They need to receive specialized food, and we provide probes as well as the nutrition, and we even develop menu for our special patients. Second breath is another program, and that is when a child from intensive care unit is discharged and can stay at home with using the artificial ventilation equipment. And of course, mothers and fathers, they don't know initially how to use this equipment, so we provide proper training how to use this artificial lung ventilator, how to change the position of the body of the child, and so on. We also provide demonstration of all types of equipment, and we provide disposable materials as well. It's very important. We do our best to provide disposals. And also we help with receiving medications and undergoing tests. We also provide hydrorehabilitation, different types of massage, and we also use pendile cries method. It's really a great methodology. And of course, our employees do their best to provide utmost support, volunteer work and support. Of course, here we provide care and games, organizing events, and it often happens that volunteers are engaged in various types of activities. We would like our children to stay as much outdoors as possible. We would like our parents to get in contact with each other. Therefore, we come up with various events so that our parents and our children will get together and will have great time. And these are the photos from our events. Some more pictures of various events. So we organize various trips, for instance, a trip to Isyk Lake or a historic trip to a historical museum and so on. So we want our parents and children go out. So what problems do we have? We don't have a proper legal framework, including standards, roadmaps. We don't have a national or regional register of children that need palliative care. We don't have public multidisciplinary services for pediatric palliative care. We don't have clinical protocols for providing palliative care to kids. We don't have mechanism of public and private partnership. We have very few professionals who medical and non-medical who are ready to work with such patients. We also lack state support when it comes to provide medications and disposals for our patients. And of course, we are talking about all types of diseases, not only cancer. And unfortunately, the assortment of pharmacological products and medications is very narrow, and that is very deplorable. These are the photos of patients and feedback from their relatives. So we had a patient, Nur, who had cancer. And this is the comment from his mom called Nura. So he needed quietness and he needed hospice, and they were very happy. Another feedback from the mom, and of course it's actually it's not a feedback, it's a letter of thanks from the moms. I'm not going to dwell on that. We can move on to the next slide. After the intensive care unit, the doctor recommended that mom is transferred to hospice together with her baby. So hospice is not about adding years of life. It is about adding life to those years that our patients have. The children should not die alone in intensive care units with fear and pain. They should be at home. So thanks to Morris Fund, we visited Switzerland not long ago. And of course, palliative care is so highly developed there. But they also face similar problems like everywhere else. And they have all needed medicines available in all dosage forms, and it is really heartening. And additionally, again, I will say that palliative care is so well developed there, and I hope that one day we will have the same level of palliative care. Of course, they have 20 plus years of experience compared to us, but we will do our best, and we hope to continue developing as robustly as we did in the past. Thank you very much for your attention, and I'm wrapping up my presentation here. Once again, thank you. I hope I didn't go beyond time protocol. Thank you, Maral. I would like to say that palliative care is emotionally challenging subject, especially when we talk about pediatric patients. And what you do working with children, you do it in such a humane way, the way you work with parents, the way you interact with colleagues from other areas, from other departments. That is incredible. Thank you for this systematic approach. And what you have mentioned at the very end is something what complements the message that your colleagues provided earlier. So it gives us full understanding about what else needs to be done in Kyrgyzstan and what can be changed for the better. We have two more speakers, Azamat Turgunbaeva and Turgunbaeva. Well, Alex, I would like to give you 5 minutes, and I would like to give the director of Republican Center, Edilbek Turgunbaeva. So could you say a few words about the specific of your work, so it will give us even better understanding and more comprehensive picture of what is going on. Hello, dear colleagues. Thank you very much for giving me the floor, given this opportunity to say a few words about our Republican hospital. It was opened based on the decree of the Ministry of Health. It was opened in January 2025. I should say that this initiative from the ministry took place due to the active effort of our colleagues from the Association of Palliative Care. So they made the opening of this Department of Palliative Care as part of the Republican Hospital possible. They made it possible. And they were pioneers, we can say. And of course, prior to that, some officials knew very little about palliative care, but these ladies were so active. They helped in terms of providing educational materials, licenses, and so on. And now we are able to use narcotic drugs. Prior to that, it was not possible. And we have here one of the teachers of our training center. But the ladies before that provided training to all our employees, and we started accepting and admitting very serious patients from day one. Of course, it's a big problem, but since the Association of Palliative Care has been in Kyrgyzstan for a long time, we have been able to synchronize our work with the National Center of Oncology.
And so we get ready to accept patients from this oncology center. And our patients in palliative center on rehabilitation usually are in the field of oncology and others, and we continue continuous treatment. Now we already discharged some patients. Nobody died in the rehabilitation center, and then we just discharge patients to come home for the continuous treatment. We also keep in touch with the families of the patients, and they say that after this rehabilitation in palliative care, these patients actually get better, and it can be seen. So there are challenges indeed. The main challenge is the personnel. We are quite remote. Even though we are in Bishkek area, still we are located quite remotely, and indeed we have a shortage of personnel, but we try to work with this. Now there was an order of the president published, and the salary of medical staff should increase twice, and it's very good, so we hope this will help. Also, on top of what is given in line with the law in terms of salary, we add 30% to this government salary that the medical workers should get. So our Ministry of Healthcare, our Association of Palliative and Hospice Care work all together, and well, we don't see any obstacles. Everybody is helping us, the Ministry of Healthcare, the association that I mentioned, and we really do it all together. Once again, I would like to thank the Association of Palliative and Hospice Care of Kyrgyzstan, and they really train workers, the personnel for free, and it's done locally, on site, I mean. Right, thank you very much. Edilbek, it's very nice that you mentioned that you don't see any obstacles. On the other hand, of course, professionals should work in palliative care. They should work with people and also work within teams, because they also need to save their energy, their resources to keep developing professionally. So I would like to wish you a success in searching for the staff for your rehabilitation center. And also our colleagues here in the chat support you immensely and wish you also to address all the challenges that you're facing. And our next speaker is Azamat Kubataev, the director of the charitable foundation Fountain of Life, or Fontan Жизни. So Azamat, could you please also give us a very short overview about what you do and how do you plan to develop further? Hello everybody, my name is Azamat. I'm the director of the charitable foundation which is called Fountain of Life. So we help homeless people. We've been doing it unofficially starting from 2003, and we started to work officially starting from 2009. So when we started to do this work, we started to diagnose homeless people that were dying, those with oncology, with cancer. Those people were coming to the national oncology centers. Fortunately, they got accepted at that time, but these patients, homeless people, could stay in the hospitals only for a short period of time. So the task that we are addressing, where to put these people after their discharge. So we were renting just some hotels, some rehabilitation center opportunities were explored. We were doing it on our own. And then we started to work on the creation of our own hospice. And in 2011, we bought a land, and then we started to construct our own hospice, the hospice where palliative care is given. And in 2021, we got a license for this. When we went to the Ministry of Healthcare in 2011, the ministry told us that there wasn't any law on palliative care at that time. And we were told, well, you can start constructing and maybe the law will follow. And when we went to the Ministry of Healthcare again in 2021, they told us that the law was indeed adopted in 2017. So now we have a license for palliative care, as well as we have the license to prescribe and give psychotropic and narcotic drugs. So if you'd like to learn some details about our activity, how we give this care, you can just go to our website. I can share the link, and you can also find us on Facebook or on Instagram, and you can learn more about us. I think this should be enough for a brief introduction of our foundation. Thank you very much, Azamat. And separately, I'd like to thank you for working with the very vulnerable groups of people. It's even more difficult than working with non-vulnerable people. And I would really like to invite our colleagues, our participants, to come to Azamat to also learn more about how they work with homeless people, also with the palliative status. Thank you for sharing. Dear colleagues, do you have any questions? We have a couple of minutes to ask questions. You can text your questions in the chat, or you can also just ask to give you the mic. So far, I only see the clapping signs in Zoom. Indeed, this is very true, because you're indeed doing a great work. While we are waiting for some questions that might come, I would like to comment that, dear colleagues, today we've heard this very valuable and useful experience from our colleagues from Kyrgyzstan, and they presented the public institution position, NGO, educational institutions positions, and it's very valuable. And for me, it's just another reminder that any sustainable change can happen thanks to specific people, professionals, experts who are really loyal to their cause. So colleagues, we are very thankful for what you do, and we're very happy that you are doing this. So I don't see any questions now, but colleagues, you can also just send your questions after the webinar.
Да, да.
Right, I
Вот,
actually see the
пока,
raised
да,
hand.
спасибо всем большое. Я
Thank
очень рада,
you
что и
very
Азамат
much.
выступил.
Thanks to
Вы знаете, как
everybody.
Азамата
I'm
мы
very
встретили?
happy to
Когда
see
мы с
Azamat.
ними,
Do you know how we
да, на
met with
Зикоте встречались?
Azamat?
Мы, Азамат играет на пианино для
Azamat
людей,
plays the
которые, ну, не
piano
имеют
for people
места проживания.
who don't have home,
Их фонд,
basically homeless
они
people.
обеспечивали горячим
So their
питанием и
foundation
местом, чтобы
also
человек мог
fed
прийти,
the homeless
искупаться в
people
душе,
with some
постирать
warm
свои
food.
вещи.
They
А
also
после этого он играл
provided some
на пианино,
just
то
hygiene
есть приобщал к
facilities
музыке.
such as a
Это было
toilet,
очень трудно.
shower,
И с тех
etc.
пор
And
вот
after this
Азамат находится в
hygienic
таком,
procedures,
знаете,
Azamat
он
was playing the
всегда
piano for these
оказывает
people.
такую
And
помощь. Так
Azamat
великий
has been
человек, я считаю,
working in
его
this,
компания,
he's
в
been
смысле
doing an
его
immense,
отец его
very important
поддерживает.
work. He's just an
А здесь вот
amazing person.
Назико написала
And
ответ на тот
Naziko
вопрос
also
про
answered to the
пролонгированную
question
форму
about
морфина. Согласно нашему
long-term
клиническому протоколу по
morphine.
лечению
In
хронической
line
боли,
with our clinical protocol
пролонгированный
on
морфин мы
chronic
не используем для
pain
титрования.
management, we do
Мы для
not
титрования
use
используем короткую
long-term
форму.
morphine
И
for
после того, как мы
titering. We
уже
only use a
выбрали
short form.
необходимую
And
дозу, мы
after
можем
we
перевести на
have selected
пролонгированный
the proper
морфин. Но
dosage,
знаете, у нас
then we can
бывают сбои,
transfer the
так как мы
patient to a
находимся,
long-term
мы
or
очень
prolonged
импортозависимые,
morphine.
Milana сказала.
We are
У
quite
нас бывают перебои с
import
поставками. И
dependent,
вот
and
был
quite
период, когда
often
не было
we see
короткой формы
some
морфина,
interruptions of
а был
supplies.
только
At some
пролонгированный.
point of time, we
Вот
didn't have a
врачи не
short-term
очень
morphine
это,
in tablets, but
они
we also
продолжали
only had
назначать это.
long-term one.
И,
And doctors didn't
конечно,
take
они
that
не
fact into
добивались сразу
account. They
снятия
continued to
боли. И это
prescribe
привело к очень таким,
this
знаете, резонансным этим.
morphine
Это
that
неэффективно,
wasn't
не стали
available,
выписывать.
and so
И компания
it didn't really
частная,
work
которая
well.
привозила,
And
вынуждена
the
была его
private
уничтожать.
company
Это был вообще полный
that was
нонсенс. У нас
actually
это была вообще
importing this
чрезвычайная это
form of
была
morphine
ситуация.
to Kyrgyzstan
Но
had to just
вот наша
dispose of the
команда,
morphine
мы
because there were a lot of
продолжаем работать
complaints about the
над
effects,
тем,
etc. But it
чтобы
wasn't done
все-таки были
properly.
все
But
формы
we
морфина.
continue to work on
И
making sure that
наша
we have all
страна
morphine
одно время
forms,
мы
long-term, short-term.
перешли полностью на частное
At
ну,
some point of
аптеки.
time, we
Не было ни
fully
одного
transferred
государственного.
to
Но с
private
учетом вот
pharmacies supplies. There
потребностей среди
wasn't
населения, да,
any public pharmacy
Министерство
in our
здравоохранения стало
network.
искать
And
другие формы
then the
возможностей. И
Ministry
вот у
of
нас было
Healthcare started
народные
to
аптеки,
search for some
такой
other
проект
uh,
начался, и
ways
установили
to
кросс-формацию. И
keep
мы сейчас
our
думаем, что
supplies
через кросс-формацию
ongoing.
у нас
And
появится
now
возможность
we are
централизованной
undergoing
закупки.
the
У
transformation
нас
period, and we
была,
hope
когда
that at the
реформа,
end we'll get the
разъединение
centralized
поликлиник от
procurement
территориальных больниц. То есть
opportunity,
это было
because there
раньше,
was
как
a
в Советском
reform
Союзе,
when
центральная
clinics
районная больница. Ее разделили абсолютно на две части,
were
и они были
decoupled
как бы такие
with the
две
hospitals.
структуры.
And so
Сейчас
basically, those were
центры
two
общей
structures.
врачебной
But
практики,
now
они объединены,
the
и это нам
centers,
позволяет
general
такую
clinics get
возможность использовать
united again, reunited,
ресурс,
and it's
чтобы
an opportunity
со
for us
стороны
to use
стационарной
this
аптеки могли
resource.
хранить
And
и могли
we will
выдавать.
use it
И
also to
даже вот то,
enable
что вы
the
видели, физическая
pharmacists in the
недоступность, что
hospitals
нету
to
достаточно
get
аптек
those
частных,
forms of
а они же не
morphine and to
заинтересованы.
store this.
Их интересует
Now the
прибыль.
problem is
Если
that we
нету
don't have
прибыли, им не нужно этот
enough
морфин
private
завозить. А
pharmacies
это
that
как
are
бы дает в
interested
рамках
in
государственной программы по
selling and
обеспечению
buy
жизненно
morphine
важного
because it's not
обезвоживания
very cost
спецсредства.
efficient for them.
Ну,
But
вот
it's
такие у нас
very
есть
vital for
видения
us,
у
and
нас,
we are
и
working on
мы
this now
думаем,
to
каким
make it in a
образом
more
вот именно есть
centralized
особенности
way.
Кыргызстана
So this is
и
the
те решения.
peculiarity of
Вот.
Kyrgyzstan.
Вот
So
это
we are
было
now
мое
working on
дополнение.
solution. Right. Thank you very much, Taalaigul, for this comment. Colleagues, can we also give the mic to Narine from Armenia? Maybe she'd like to comment on something or ask a following or a follow-up question. Narine, let's test your mic. Right. First, I would like to express my amazement by the work that you've been doing, dear colleagues. Indeed, it's a great achievement over this short period of time. Why I asked my question about morphine, right? Because quite often these different forms of morphine are not used properly. We do not start with titering long-term morphine. Why I asked about this specifically? Actually, you already confirmed my thoughts. My thoughts are when a drug is used improperly, in the wrong way, it discredits the drug, and then there can be some complaints, and then it can even be withdrawn from the market. We faced problems like this as well, because we had fentanyl patches and we had a problem with those. It was at the beginning of our development. And well, another comment, I've been working in this field for quite a long time, and I'm also an anesthesiologist by my major. You mentioned Promidol. So Promidol is not used for chronic pain relief because it's toxic. So maybe you can revisit your practices now just to make sure that you are successful in everything that you do. Thank you very much once again. It was a great pleasure for me, unique experience, unique knowledge, and good luck to you all. Thank you.
Спасибо большое, Нарина.
Narine, thank you very much for these valuable comments. Colleagues, it's time for us to wrap up our webinar. I join the words of Narine that it was indeed very interesting, very valuable, and I would really like to wish you good luck in everything that you will be doing, dear colleagues. So now you'll see in our chat the links to the PASTE website, to our social media. Please subscribe to our newsletters. You'll see all the necessary links in the chat. Also join our expert chat in Zoom chat. Will now post the link to join it. So I would once again like to thank great professionals from Kyrgyzstan. It's Taalaigul, Sabyrbekova, Milana, Turgunalieva, Gulzhakhan, Pirnazarova, Maral, Turdumatova, Edilbek, Turgunbaev, and Azamat Kubataev. So, colleagues, thank you very much. And dear participants, dear speakers, when you'll be exiting our Zoom meeting, you'll see the feedback form. Please fill it in. It will be very valuable for us. I would like to thank our interpreters, Anna Akmaeva and Ksenia Rusova. Thank you for being with us today. It was a webinar on Kyrgyzstan, and it was PASTE team with you, and see you soon. Thank you.